All right, so I'm going to get started. Good morning. I am happy to welcome you all to the presentation today. We're the Pentucket Perinatal Mental Health Coalition, and we're a kind of a group of organizations and therapists, prescribers in the North Shore area, kind of Haverhill through Newburyport, and we do a lot of advocacy and share information and education for the perinatal population in our area to support their mental health. We're going to talk about trauma-informed care today. I am Beth Brown. I'm a local clinical social worker. I work only with perinatal women in both Massachusetts and New Hampshire Seacoast. I primarily use a trauma lens, which is why I'm going to talk about it today, in working with women. And I use a specific trauma therapy called EMDR to help my clients heal. Please feel free to post any questions you have in the chat. Allison Sikowski, she's a member of our coalition and introduce herself, Director of Maternal Child Health at Anna Jakes, will be monitoring the chat for me, and I'll just pause at different points in the presentation to answer questions. And again, for those who are just joining, if you don't mind just listing we know who you are, your name's listed, but maybe your role or who you work for, how you work with women, and maybe something you're looking to learn from today's presentation, that would be great. Also in today's discussion, I'm going to use the word client to refer to the women we work with, because that's the word I use, but you may use a different word, mother, family, patient. So just install whatever word you want to make sense of it for yourself. Okay, so here's what we're going to cover today. First, we're going to talk about what do we really mean by trauma, and then how does it affect our bodies? And then we're going to discuss what trauma actually looks like in real life, how to identify it, how we can show up for families we work with in a trauma-informed way. And then we're going to talk about burnout and secondary trauma, as well as just touching on some resources for you all at the end. All right, so I'm just going to get started. So what is trauma? In very simple terms, in a nutshell, trauma occurs when stress outweighs coping. And what affects our ability to cope? Well, a lot of things. There's a lot of internal and a lot of external factors that determine how much stress we can cope with, right? So yes, these are strainers of different sizes. I like to use the strainer analogy. When I was young, we used to make orange juice from concentrate. Y'all remember those frozen blobs that you added water to and stirred forever. But we used to hate the pulp when we were little, so we would strain it out. And it kind of correlates to the idea of trauma and how much stress we can cope with when you think about that. The size of our strainer directly correlates to how much juice and pulp you can put in it. And when we're young, our strainer's little and can't handle that much juice or pulp or stress. So in addition, like if we smoke, never sleep, live in poverty, if we belong to a marginalized group, if we have little social support, if we have unsupported or unhealthy family members, our strainer size can be affected. So we really can't cope with as much stress. So even a small amount of stress can cause a traumatic reaction, right? And trauma to be stored in our brain. This isn't our fault. It's just sort of how our nervous systems work, which I'll get into in a bit. And this may seem really obvious, but I wanted to it's really important to remember that when we consider what causes trauma for someone, what one person perceives as traumatic may not be what someone else perceives as traumatic, because of the difference in the size of the strainers, right? Everybody's ability to cope with stress is affected by a lot of things. I can't tell you how many of my clients will say, But that's not trauma when we talk about something that happened to them. And then I always say, well, when you were 3, and when that happened, whatever that was that happened, your strainer was really small. So if you think about it, like if you have a parent that minimizes your sadness over like a lost lovey that you can't find, your strainer shrinks. And say it's the same day that your parents had a big fight and were yelling at each other, or if you were sick with a cold or the stomach bug, your strainer's even smaller. Your ability to cope is even smaller. So we know for this reason that early childhood stress has a greater impact on trauma load later in life, and later in life stressful experiences. So I want to take a moment just to talk about the Adverse Childhood Experiences Study, the ACEs. There's actually a couple really good YouTube videos out there. I think the one's a TED Talk from a pediatrician. You can take a look. It's really interesting. And this was a study that was done in the 1990s, was one of the largest studies ever looking at early childhood abuse, neglect, and then the impact on health and wellness outcomes. So these are some of the questions. These are the 10 questions asked in the ACEs. And, things like, was anyone in your house growing up depressed or mentally ill, or had a problem with drugs or alcohol? Were your parents divorced or separated? I mean, that's 50% of the population right there. Did anyone hit or verbally insult you? So these questions affect a large proportion of the population. So it's not that hard to rack up a few of these for yourself. I think the number is about 61% of the population says they have at least one of these adverse childhood experiences. 1 in 5 people have 3 or more. And these aren't really these aren't the only stressful experiences that affect health and wellness or affect how we see ourselves or cope. So there's tons of negative effects from adverse experiences, and it really affects your body in astounding ways. For example, if you have 4 or more ACEs, you're 2.5 times more likely to have COPD, which is chronic obstructive pulmonary disease, I think. You're 2.5 times more likely to have hepatitis, and you're 4.5 times more likely to be depressed. And the risk for suicidality is 12 times. So, I mean, those are big numbers. We really kind of see that trauma affects all these different aspects of our lives: health, relationships, learning, and even our future children through gene expression and epigenetics. So I just wanted to take a second and just see, are there any questions so far, Allison?
Nope, just introductions. Thanks, Beth.
Okay. All right, so we're going to shift from talking about what trauma is and how it affects us to what's actually happening in our nervous systems and bodies when we're subjected to more stress than we can cope with. So this is your brain, obviously. Data comes from the bottom up, from the bottom of our brain up, meaning we perceive the world and information, and that information that comes in first to your brainstem, where all those autonomic nervous system, our automatic nervous system things happen: breathing, digestion, things we don't think about. Then up through our limbic system, the center part of our brain, which stores emotion, nonverbals, sensory information, right? Our 5 senses. Then it moves up to the prefrontal cortex, right up here in the front of your brain, which is all learning, logic, where time is sequential, where you make decisions. And when we think about evolution, the brainstem developed first, then the limbic system, then, we developed a prefrontal cortex. And I want to just illustrate for you all how automatic and quick your nervous systems respond to data that's coming in. So I'm going to smile, right? And I want you all to look at my face. And then I want you to register in your body how that feels to look at a smiling face. And then I'm going to change my facial expression. And I want you to see the impact of that change on your body. So what did you feel right there? You know, a lot of people feel like a little bit of right? Like a little pullback because it feels like something, but it's so quick. You know, I'm going to change my facial expression and you still had the reaction. It's almost like your nervous system responds to things that, you know, it's like automatic, and it responds to something that feels similar. So for example, like if I see a coiled rope in the corner of the room and I walk in, I automatically think it's a snake because it looks similar, right? So my nervous system, the data comes in from the bottom up and it automatically responds before my thinking brain turns on and says, oh, that's just Beth changing her facial expression. Oh, that's just a coiled rope, right? So your nervous system, like, and you know, it's like central nervous system, it perceives danger, responds before thinking happens. It automatically determines how to respond. So you really don't have a say. So if something stressful happens to you and it overwhelms like your ability to cope, then your brain imprints that experience in your limbic system, right? In that center part of your brain as sensations and emotions and feelings, okay, in your body. It relates in its sensation, like in my shoulders, I feel that, or in my chest, I feel tightness. That's right. So it's stored not logically, but by sensation, emotions, right? Feelings, sensations in your body. So this is so that you can quickly remember, right? Next time something that's similar happens, you want to protect yourself without having to think, right? That's how a normal healthy nervous system works. Then later, like, right, if your nervous system perceives a threat that feels the same as something that was dangerous before, it triggers a protective nervous system response automatically. That's what happened when my facial expression changed. Your system responds automatically to that, right? Because frowns aren't great. We don't like, you know, frowny faces. It signifies something negative typically. So the autonomic nervous system gets activated, our thinking brain turns off when that happens, and we move to protect ourselves. It feels like what happened before is happening again, right? So this is like post-traumatic stress. It triggers something that happened before. It feels like it's happening again. And that's happening in our bodies, not logically in our prefrontal cortex. Okay, so just as an example, I'm going to talk about mother-in-laws because we all like that, or not really. So if my mother-in-law, for example, is at my house and she tells me there's no toilet paper left, this might bring up feelings that I have felt before. So say my father criticized me my whole life growing up, little things here and there. And that feels the same. Then when my mother-in-law says that, and so even though she's just telling me there's no toilet paper, I feel criticized, right? So, or for example, if I was attacked by a dog that barked before it bit me, the sound of a dog barking can trigger feelings of fear in my body. So the protective responses are automatic, and you know them, right? It's fight, flight, and freeze. I'm sure many of you have heard of that, those different protective mechanisms. So I want to talk about these three protective responses in the context of what's called the polyvagal theory. Okay, so there's a researcher named Stephen Porges. He developed a theory about the autonomic nervous system, which describes our protective responses of fight, flight, and freeze. If we think about it as a ladder, see there on the right-hand side of the slide, and that brain we just looked at, it's kind of like a ladder too, from the bottom up. The top of our ladder would be our prefrontal cortex, that part of your brain that developed most recently, which is our logical, connected, engaged brain. If you see over there on the left, there's safety, right? That's sort of that top part. I feel safe, I'm calm, I'm ready to problem solve, I'm able to communicate, and all my protective mechanisms are off. Okay, so if I use the example of a bunny rabbit, I'm not going to say rabbit because it's not as mommy oriented, right? We all are saying bunny rabbit. The bunny is just like busy eating grass in this state. He's calm and relaxed. Then if the bunny hears the snap of a stick, it perks up, right? The nervous system becomes alert. Now we're moving down that ladder into the older parts of our brain. If the bunny sees a bobcat coming out of the woods, its nervous system immediately moves into fight or flight, right? That middle calm, danger, there's danger, right? And then you move down into that sympathetic nervous system. I'm in danger. I need to run or fight back, which, by the way, your body will just decide, can I fight here? Well, it's a bobcat. No, I can't fight here. I'm going to run, right? This hyper aroused state is faster breathing, faster heart rate. It feels like anxiety, anger, panic. I'm quick to blame. I'm either moving away or towards a threat, depending on what your body thinks is best for your best option for your survival. So if the bobcat catches the bunny's going to move to the bottom of the ladder into a freeze, a dorsal vagal response, right? It's a life threat. This is if there's too much stress in your system, you're going to turn off. And this is a hypo-aroused, dissociated state. Your heart rate slows down, your breathing slows down. And you may all recognize this as that, like, I feel shut down, right? I have a hard time thinking clearly. I feel overwhelmed, hopeless, helpless. And I'm going to talk about freeze in a little bit more in a moment, but you may recognize that, right? So those two states are hyper aroused. I'm going to run or fight. I feel really activated. Or they're really shut down. I'm really tired. I'm really heavy. I might feel cold in my body. I have a hard time thinking. It's like depression, right? It feels really heavy, but this is a normal nervous system response to danger, right? So if you have moments of the day where you feel that way, this may be what's happening. So I want to just give an example of how strong and automatic these responses are. Recently, Oprah came out with a book with Dr. Bruce Perry called What Happened to You. I don't know if any of you have read it. It's a great introduction to trauma and understanding trauma. In the book, Dr. Perry talks about a research study he conducted during which he worked with a boy who had been beaten so badly that by his foster father that he was in a coma. So this same boy had also been physically abused by his biological father when he was younger. So Dr. Perry first held a shirt worn by his foster father to the boy's nose, and the boy's heart rate and respiration monitors accelerated drastically. Boom, hyper aroused. Even in a coma, the boy's body went into fight or flight. Then Dr. Perry held a shirt that had been worn by his biological father to the boy's nose, and the boy's respiration and heart rate plummeted. He froze, dissociated, right? He was very young when his father abused him, and he couldn't have gotten out. When he was older with the foster dad, he was more capable of fighting back. So it's amazing how his body still responds even in a state where he's just really otherwise not responsive. It's so deep in the brain. It's really amazing, isn't it? So I just want to talk about this little kitty cat here. So cute. I just want to talk quickly about the energy that gets trapped in a freeze response and what should happen afterwards, but doesn't. So according to Peter Levine, he's a well-known trauma researcher and author. He's got a couple great books out, which I'll refer to at the end for resources. When we go into freeze, all of the energy that was generated by that bunny during fight or flight gets trapped Okay, so, and we move into freeze, just different times in our lives. Different things happen to us and it overwhelms our nervous systems. So if you watch an animal after freeze, you're going to see that they go through a physiological process of becoming sort of unfrozen or stuck. We humans tend not to allow this process to happen. We suppress this natural response. And this is what Levine and other researchers say causes post-traumatic stress. One theory. I actually recently had the privilege of watching a bird that had flown into my newly cleaned glass slider move through this physiological release response. Took 15 minutes, and yes, my arm hurt while I videotaped it. But I included the link to the YouTube video in the resources at the end of the presentation. And it's actually pretty amazing to watch because I've seen clients in my sessions with me do that exact kind of physiological release during trauma processing. So it's pretty natural for us to go through that process. We often just suppress it because it kind of feels uncomfortable and weird. And, if we fall, we just kind of want to get up and, oh, I'm fine. But there's actually a process that would normally happen. Okay, I don't see any change in the chat. Allison, any questions so far? Does anyone have any questions?
Nothing so far, Beth.
Okay, just want to make sure it makes sense.
Nothing so far, but I'm really intrigued because I'm here on the flight of flights, and I think I go there sometimes, right?
Well, if you're a normal human being, you do go there sometimes, right? I mean, this is the way our nervous system works. And it's so interesting. I was watching this bird and I was like, we are all the same. Really. I mean, all of us creatures here, we're all the same. We all have a nervous system.
Mm-hmm.
Yep. Awesome. Okay. So now we know what happens biologically in your body and brain, but what happens in your mind and your thoughts during traumatic stress? The overload of stress also distorts our thinking, specifically about ourselves. Okay. So we tend to see 4 themes of distorted thinking. And you're going to identify with some of these because, again, you have bodies and you're human and stuff happens to us. So either it's inadequacy, like I'm not good enough, defectiveness, there's something wrong with me, or responsibility, it's my fault, I should have done something, safety, I'm not safe. And there's beliefs about power and control, like I can't handle it, I'm powerless, helpless, I can't get what I want. And we're all really walking around with some version of these distorted beliefs swirling around in our heads and our bodies. Sometimes typically I see people predominantly believing either the first 2 or the last 2, but honestly, we all have some inadequacy or defectiveness floating around. It's pretty normal. And so the reason that the stress load can distort our thinking is related to that early in life, right? I use a keyhole as an example or analogy, is that when these beliefs tend to take hold, our perspective of the world is it's like looking through a small keyhole, right? We don't have an adult's perspective, which would be the whole door open to see the whole room. We just see like a small little portion of it. And then we make assumptions about what we see, right? We don't know, for example, when we're little, that things change, that they end and finish, that people and situations aren't black and white, right? We don't understand nuance. Like I often say to my clients, when you're little, you don't understand like, oh, there's people in China sleeping right now. Oh, or like, I remember the first time I realized that my aunt was my mom's sister. I was like, what? That's like my sister? So crazy, right? It's like in that moment, my keyhole got bigger. My understanding of the world grew. But when we experience trauma and traumatic stress as a child, those beliefs get bundled up with that limited perspective of the world and get stored in our limbic system with the rest of those sensations and emotions that go along with those experiences. And then we just keep assuming, the same things each time something feels the same over and over until that belief gets pretty entrenched, right? So, for example, when we're 3 or 4, we might see our mom angry about a fight she had with our dad and think it was our fault, right? Not knowing that they have their own dynamic over there, right? My parents are having their own, he left the milk out again. And, he left the milk out because he was worried about work, right? And my mom, mom got mad, and I don't have a big perspective. My world is just very small. I see my parents, me, maybe a sibling. And I think, well, that anger must be about me. So it seems really obvious to us as adults now, but I bet if you go back in your own childhood, you'll find plenty of examples of like distorted thinking like this, which you may not even see as distorted, which is also pretty normal. So you might see these beliefs showing up with the women and the mothers that you work with, right? You're going to see some of that. One of those four beliefs. So what does trauma look like? What do you tend to see? Well, kind of everything, to be honest. It can look like these distorted beliefs. It can be, say, aggressive, angry, defensive behavior, right? Because that's a fight response. It can be the desire to be alone or socially withdraw. It can be anxiety, like repetitive thinking about safety or death, or an exaggerated startle response. It could be that hypo-aroused, right, freeze where there's spaciness, forgetting things repeatedly, not being able to attend or focus, emotional numbing, right? I don't feel anything. I don't have emotion. That's more like living in sort of a frozen place. It can be substance use, right? Because if we have some sensations in our body and all this stuff, we just don't want to feel that. And so we numb it in a lot of different ways. It can show up in people's bodies like headaches, stomach aches, rashes, muscle spasm, right? When your back goes out, your neck goes out, your shoulder goes out, whatever. That's often related to stress. And sometimes it's old stress exacerbated by current stress that feels the same as that old stress. So, when I think about birthing moms, I was a doula for a long time. And when I would get these sort of rigid, angry or distrusting birth plans, I would sort of say like, when you look at that through a trauma perspective, those folks are protecting themselves because something feels dangerous, right? All of that reactivity and anger or defensiveness you may see with clients you work with. Those are all trauma responses, right? Even if you respond to, like, let's use the mother-in-law example again, to your mother-in-law a certain way and it feels big, that's often a trauma response, right? Something else, it's like a triggered response. So any questions yet? Because I'm going to move into the trauma-informed care piece, and I wanted to just check.
Looking good, Beth.
Good. All right. All right. So now that we can see people through a trauma lens, it's making sense so far, and ourselves, honestly, how do we care for others in a way that considers the stress that still might be stored in their bodies, right? And in this middle part of their brain. And, trauma-informed care looks to understand how pervasive trauma is, understand how we might heal it. We want to recognize a trauma response when we see one. Right. And if you think about anything that disconnects us from each other, those are trauma responses. We want to integrate our understanding of trauma into how we work with people. And we really just don't want to re-traumatize people. So how do we do that? How might you act or approach someone differently, knowing their behavior and emotions and thoughts and sensations are all driven by something that happened to them previously? Like, how does that shift your thinking? So these are the main elements of trauma-informed care, and I'm just going to talk about each one of these in depth, and I am going to ask some questions of you. You don't have to answer publicly at all. I just to jot them down for yourself. So like, for example, safety. And we're talking both physical and emotional safety here. And I just want you to take a second to consider what makes you feel safe when you're with other people, when you go to the doctor, when you drop your kids at school, when you're at work, when you interact with someone at the grocery store, when you're giving or getting a performance review. What makes you feel safe? So just jot down a few words. It's a good question, right? So some of the things you might consider at work to help others feel, your clients or women, feel safe might be like, well, who's present while you're working while we're working with a woman? What impact do these people have on her? Are the doors open, closed, locked? Are there easily accessible exits? Where are we sitting in relationship to the other person? Would they feel blocked in? Is there adequate space? Or is it too cramped? Am I sitting too close to somebody, right? Space between people is super important. If you have a breastfeeding mom, is there a place where she can have privacy that's with a locked door so she feels safe enough? Are there clear expectations and communication about what's about to happen with someone, especially if you're working with their body, right? If you're touching someone's body, we want to have clear communication about what's about to happen and some of the rationale, right? Why am I about to do what I'm about to do? Are we watching for signs of discomfort or unease? And do we see them through this lens, right? Through this trauma lens? Do we ask about women's safety at home? Do we respond? And how do we respond when someone's defensive with us, right? Do you tell someone when you're about to move? For example, I've had many clients when I was still in my office, I would have to say, I'm going to get up right now and grab a piece of paper from over there. And I would just wait for them to sort of take that in and, is that okay? And they would say yes or no. Right. So that sudden movement, sometimes if they don't know we're going to move, might just trigger their bodies into feeling defensive. Okay, so safety. So trustworthiness, transparency. So we do this through clarity, right? Being clear, let me say clear is kind, being consistent and having really healthy interpersonal boundaries. And I'll just keep saying the word boundaries over and over, right? But I'm curious, just to take a second for yourself right now, what helps you trust someone? Right? What helps you trust someone? Trust is so important. So do we, some of the questions to ask yourself, do we maintain healthy professional boundaries, right? Or are you sharing more information than you might want to? Personal information, touching, exchanging home phone numbers, contact outside of professional appointments, even things like loaning money, are all really inappropriate professional boundary violations. And it makes people not understand like where you are and where I am. Clear boundaries can really help people back to the safety piece. Do you do what you said you were going to do, right? Do you follow up? Are you truthful? one of the things that can happen is that we gossip about others in front of clients. And so they're immediately going to think, well, they must be gossiping about me too. Informed consent, right? What's involved in that process? Do we take that seriously? Are the goals and risks and benefits outlined where clients actually do have, sorry, I'm going to make my cat get down because he's going to bother me and get in front of the screen. Do we have clients have actual option, right, to give consent or even just to give partial consent? Trusting someone might, right, for many people, that might be really hard as they haven't learned to trust anybody because those early care providers weren't trustworthy or weren't consistent, or didn't do what they said they were going to do. So it's important for us to sort of show up in a really consistent way with the women we work with. So choice. So again, I'm going to ask, so we really want clients to have choice and control. What makes you feel like you have choice and control in various situations, right? You go to the doctor, or you're in for performance review, or you're talking with a friend, right? Or a partner. What makes you feel like you have some choice and control? So some of the questions you might ask yourself. So how much choice does each client have over what services they receive? Control over when, where, by whom the service is provided, right? Day of the week, time, office versus home, gender of the provider. And what are some of the ways that we can give people choice, even if we don't have control over certain aspects of like either the program we work for or where we work, insurance, things like that are outside of our control. But what can we give the clients we work with? Do they choose how contact's made? For example, do you want me to phone, mail, come to your house, go to some other address? Like, how do you want me to contact you? It's small, but still meaningful. Do we build in small choices that make a difference to women? When do you want me to call? Is this the best number? Is there some other way you'd want me to reach out and get in touch? Do they have control over when they stop and start services, or when, about their own goals, like determining what their goals are? So like, if you think about it, even a small choice about where do you want to sit, it also encourages some introspection, right? So consideration of like, well, what do I want? Right. And for a lot of women, they've been disempowered and haven't had that opportunity to just figure out what do I want? Not what does everybody else want, but what do I want? Right. That really reinforces that they have a sense of self, that they matter, and that they have agency over what they want, right? They can get what they want. Many people didn't get that choice and don't think they have a right to it. And then collaboration. Okay, so working collaboratively is all about sharing power, right? So what makes you feel like like someone's working with you? What makes you feel like someone's actually working with you and sharing power with you, working collaboratively? So some of the questions you might ask yourself are, do we communicate respect for the client's life experiences and history? Right? Allowing the client to place them in context, being in context, like recognizing their strengths and skills. Do we give their goals and priorities weight to what we think they should be doing? right? Working together to develop those goals? Do we really cultivate like a model of working with rather than to or for someone? Right? Do we really communicate to them that we believe that they're the expert on their own experience? They know themselves, they know their babies, they know their kids. Right? That might be the first time, right? Working with you might be the first time that someone knows what it's like to work with someone. And you actually might have to teach them how to do that. They've never had a place to learn how to connect in this way, right? It might be dangerous even to someone's like sense their body to work in this way. And then empowerment. This is actually my favorite. So we really want women to feel empowered and to build skills for themselves. So the question for you is, what makes you feel like you're empowered? What makes you feel like you have agency in your own life? So just take a second, write a few things down. For me, it's always about choice. So how do we recognize clients' strengths and skills when we're working with them, right? How do we communicate a sense of like realistic optimism about the capacities women have to reach their goals, right? Do we cheer them on? We don't do things for them. We just coach them, right? We cheer them on. And then they can internalize that belief about themselves, right? It's like teaching your kid to learn to ride their bike. They have to ride the bike. You're not going to ride it for them, right? Believing that they can do it. Do we emphasize client growth more than maintenance or stability? How do we foster the involvement of these moms in key roles, like in planning and implementation of their own services, right? Every time we interact with a client, how can we help them feel validated and affirmed? Right? We often see the women that we work with, they don't have that agency, right? They don't know that they can make that change. And it really reminds me of, there was an experiment years ago before we had good ethics in research, where they would have two dogs in cages. One of the dogs would have the door closed to the cage, and one of them would always have it open. And they would shock both dogs, and the dog that the door was open would run away, right? Because it was a shock. And then they would do that over and over, and they opened both doors and shocked the dogs. And the dog that always had the door closed didn't run because he didn't know he could, because the door had always been closed before. So even though it seems obvious, like, oh, but look, you can run, that dog's body does not recognize that the door is open. Right? So in the same way, many of the clients and women we work with don't know that they have the agency and the wherewithal to make change in their lives. Right? So we sort of hold that for them and work towards believing in them that they can do that. And then humility and responsiveness. And, when you think about yourself, how would you like others to interact with you about your cultural identity, right? Race, sex, gender, ethnicity, age. So just take a second and think about that. Write something down. How do you want others to interact with you about your cultural identity? Right? Some questions to ask are things like, have we really considered and questioned the biases and stereotypes that we have learned and internalized? Do we consider how they show up when we work with families? Right? Have we really cultivated and practiced curiosity in relation to cultural identity? right? Do we have ways that we can call these things out in relationship to the clients we work with? So hopefully by sort of having you guys identify what it's like to be treated, like how you would want to be treated, it helps you understand how most people want to be treated, right? Whether they're having a trauma response or not, we would use trauma-informed care across the board, right? So let me see. I just want to take a second. That was a lot of information. See if there's any questions about these elements before talking a little bit more on specifics about how we can help and what we do. Anything so far?
One chat, just somebody had to pop off that said, thank you very much for the presentation. No questions so far in the chat.
Okay, thanks, Allison. Okay, so really, how can we help, right? These are some just kind of some of the repeated, some of what we just talked about, but I want to kind of go into it a little more like grit, right? A little more realistic wording to translate some of those elements, right? Like how are we actually showing up with clients? Well, one, we want to create a predictable, calm space. And that means that we want to be present, calm, and non-reactive ourselves, right? It means we want to know our own triggers, heal them if possible, do our own work, because honestly, it's going to increase the size of your strainer, right? Yourself. So by doing your own work, you're just going to feel better anyway. And then everybody else is going to feel better around you. We want to recognize when someone is projecting the feelings from their trauma response onto us and not take it personally. It really often isn't about us. It's about what happened to them. Or I guess, frankly, it's really what happened to us interacting with what happened to them, right? It kind of creates a cycle. It means grounding others by grounding ourselves first, right? Feeling really present here in your body, calm. And boundaries are so important, right? Creating healthy boundaries is about knowing what's yours and what's mine, and for there to be separation, right? You standing on your own, me standing on my own, and working together. There are so many good books. I mean, we could have a whole, 2-hour presentation or 2-day presentation on creating healthy boundaries, but there's so many good books about boundaries out there. My favorite is Codependent No More. It's kind of an oldie but a goodie. Not that big of a book, but it is a good one. So if you want more information about boundaries and how to create healthy ones, that's a good place to start. When you're working with someone who's emotional, right? Address the nervous system, that person's body, not not the logical mind. You can't talk someone out of being triggered because they don't have access to that part of their brain. You remember, like, think of 3-year-olds. 3-year-olds, when they're having a temper tantrum, there's no reasoning with anybody, with those kids, right? And when we're in our emotional brain, we don't have access to our logical brain. So we hold space for emotion first. And then once their brain's back online, you can talk to the logical part of their brain. And we'll talk about how to do that in a moment. Don't judge somebody else's trauma. Don't judge your own, right? Because this is, this is easier said than done, right? But what happened to someone as a child, specifically, it's not their fault. And it's not your fault. And if somebody's really continuing to reenact their own trauma, because that happens, it's even really more important, right? To help them feel empowered so that it can understand they have the agency to make change and heal. We want to empower them by giving them choice, which we talked about, helping them find their way, becoming their coach, not their rescuer. We want to educate clients about what's happening in their bodies, right? Ask them if they want to know more about what you just learned today. So you can really do like a lot of this helping people by holding space for them, using techniques to calm your own and their nervous systems, and then by using non-directive communication. When I'll talk about all of those next. So how do we hold space? Right? We love little hugging mamas and babies. Look at that. So years ago, before I became a therapist, I was a birth doula. I mentioned that earlier. And I would go to births with the birthing women and her partner. And at first, I really wanted to get my hands in there and help, right? I was going to fix it all. But I noticed pretty quickly that this actually was not helpful. So I began to sit on my hands, like really sit on my hands, to sort of indicate to myself that I was there to hold space and provide support when it was needed, usually just verbal support, sometimes using my hands to apply pressure or just hold a woman's hand so she knew I was there. But that's really all people need most of the time. It's really hard for us to sit with others while they're going through something difficult, right? Maybe those distorted beliefs come up for us, like I'm feeling powerless sitting here watching this woman struggle, or I feel like it's my job to fix her. We often feel sensations in our own bodies that are uncomfortable in those situations, and we want them to go away, right? So we want to fix the other person. But in essence, we're triggered. So I really encourage you to practice sitting with those sensations and beliefs in your own body and learn how to regulate your own nervous system so that you can hold space for others. So here are some ways to do that. So we practice grounding ourselves, right? Feeling our feet on the floor, and staying calm when our client's distressed. And you can Google grounding exercises, and honestly, there's a million out there, and you can practice those often so that the skills are ready ready when you need them. This is how our mirror neurons work, right? So if I'm calm, you're going to be calm. If I get really distressed, it's going to work you up. You're going to feel that in your body. We can listen and reflect what someone says. We can clarify understanding. So for example, you might say, so what you're telling me is that you're angry, or it sounds like you're angry, or that sounds hard, or just nod, soften your eyes and face like this. Right? Just a little softening right here. And if you're stuck, you just say, tell me more about that, right? Have them keep talking, just keep asking questions. And these are really skills to practice, right? You're not walking out like, oh, I'm super good at this all of a sudden. These are things that we practice. And we fail. We don't do a great job, and then we learn, and then we just keep practicing. You also can ask someone directly, right? Do you want advice, or do you want me to listen? 9 times out of 10, they're going to want you to listen first at a minimum. This is a great thing to teach your husbands and partners how to say to you, is to say, do you want advice, or do you want me to listen? Right? 9 times out of 10, you're saying, just listen. I just need to vent. It's also helpful to know that people's emotions, our own, pass like a bell curve. So be patient, right? It takes a boop, little, and then it comes back down, kind of like a contraction when you think about birth. And I know time's of the essence, but you're not really going to get what you'd want done with someone if they're dysregulated, unless you hold space first. Plus, this really builds trust, an alliance, and a relationship with your clients. And have faith that the other person's going to figure it out, right? This is their life, back to boundaries. And it isn't your business whether they're going to fix it or not, right? So it's just holding faith that they're going to figure it out. It's going to work out for them the way it's going to work out. And this one I hear a lot from clients. They have learned that fixing is caring. And this is, this is how I show people that I love and care about them. I fix their stuff, but this isn't actually correct. We show people we care by holding space, right? So keep those boundaries in place. Or, you can also sit on your hands, right? And I have this one friend who, for a long time, she was putting her finger on her lips like this. And she would listen to everyone and listen to her husband and listen to her kids, and her finger was on her lips. And I asked her one day, like, why are you putting your fingers on your lips? And she was like, so I shut up. And I was like, oh, so smart, right? She was trying to sort of hold space, kind of like me sitting on my hands, but she would just put her finger on her lips. You can also breathe. You can count, maybe just count to 10. 1, 2, 3, right? Or say a few words over and over to yourself, like a mantra. For example, like, they can do this. This is not about me, or I've got this, or I am calm, right? Breathe in, breathe out. Okay, so ground, boundaries, breathe, no fixing, hold in space. Okay. Any questions so far, Allison? I'm going to take that as a no.
Oh, I'm sorry. I thought I hit unmute. We have a love for the fixing is not caring point, and that's it.
Awesome. Yes, this is so important. Just hold space. Okay. And we know how we feel, in our own relationships when people try to fix our stuff and we're like, just want you to listen. All right. So how do we regulate our nervous systems, right? Our own, and help others regulate theirs, right? So we can learn these skills ourselves and we can teach them to other people. So there's 2 ways to go about it: bottom up or top down. So, and we're talking about the brain here, right? We're going to go from bottom up, body first, or thinking first, down. And honestly, you can Google any of these techniques and practice them as ways to soothe yourself or teach your clients. Let them practice themselves or do it together. This is actually very nice if someone's really dysregulated and you feel really dysregulated, is to say, let's do some breathing together. So progressive muscle relaxation is, we're inhaling and we're tensing. Maybe you start at your feet, you start at your head, and you tense, inhale, exhale, relax, right? You do each body part one at a time, just inhaling, tense, exhale, relax. Breathing. There's a lot of, different breath exercises out there, but honestly, it's just breathe in for 4, breathe out for 4, count to 4. If you're feeling really anxious, you want to breathe in with less breath, 4, exhale for 8, right? So opposite, if you're feeling really dorsal vagal freeze response, you would breathe in more oxygen, right, to bring you up into a more aroused state, 8, and then exhale for 4, right? So you're modifying what state you're in by using your breath. Rocking and rhythm, this is an old birth thing that I used to use as a doula too, but really just, I have clients that will rock. It's soothing, right? This is why we rock our babies. You can go side to side, just really finding some rhythm. Even just if you think of like drumming, right? Some kind of rhythmic something. This is walking, this is so helpful. Even running, just the pounding of the feet, just very rhythmic. And then there's a exercise I really like, 5, 4, 3, 2, 1. Name 5 things you see, 4 things you touch, 3 things you hear, 2 things you smell, 1 thing you taste. And honestly, you can Google 5, 4, 3, 2, 1. It'll take you through that exercise. And you may need something that arouses you, right? If you're shut down, you're hypo aroused. And so that's where like cold water comes into play, or crunchy snacks. Sometimes cold water putting your face into a bowl of cold water, really cold water for 30 seconds will initiate this dive reflex we have, and it will bring you out of whatever state you're in. Cold shower, super hard. I know all these folks are cold, going dipping into the ocean at this time of year and in the winter. Oh, so cold, but boy, that'll regulate your nervous system pretty quick. I used to give my kids carrots to eat to sort of regulate them, pretzels, same kind of thing. So you're really using the body to regulate your nervous system. And then top down, mindfulness, which is really just observing without judgment, right? So I might look at a leaf and ponder the leaf and all the veins in the leaf, and I'm really noticing, right? Or I'm just observing what I'm feeling and the sensations in my body. Just any kind of mindfulness exercise. Cognitive behavioral therapy, changing how you think about something, which affects how you feel about it. So you're really starting with the thoughts and working down to your body. And you have different things that grounds you to regulate your nervous systems. One funny thing that I'll bring up is that years ago, I think I was on a ski lift and I was like really anxious. And I realized that putting something against my lips soothed my nervous system, settled me immediately, because when I was little, I sucked my thumb. So the pressure, right, that's like sort of instilled in my body now, the pressure against my lips of my thumb and my hand reminds me of being soothed. So you can kind of figure out all the little things. People play with their hair, right? Do all kinds of things to soothe your nervous system. And then another thing we can use is non-directive communication. So
Hey, Beth, can I just pause you? We do have a quick question in the chat.
Yeah.
And it's, how can we better support a client who may be experiencing freeze and doesn't communicate via phone or misses appointments because they are overwhelmed and shut down?
So if you're not with someone, there's not much you can do to help them, right? Is that what you're saying? Like, how do I help somebody that I'm not seeing?
Yeah, so that if they've gone into freeze and then you cannot communicate with, is there any technique you could use?
Well, I mean, I guess if you have a relationship with someone and you're teaching them skills up front, right? Like if you know somebody's often going into freeze, you may sort of just recognize like, oh, I need to teach them some regulation skills, or just practice one or two so that maybe they can respond. But there's really no way, right? This is out of your power and control. Speaking of power and control, to have somebody, like even for me, to have someone come into therapy, right? I can't make anybody come to therapy. There's really no way that I can help someone regulate if they don't show up, right? Because then they're disconnected from me. You'd have to be engaged with them to have someone regulate. But you can teach them how to regulate themselves when you do see them, right? But I really hear that. I hear it's really hard to do, and it's hard to sit with when somebody, this is the piece around understanding what's in your control and what's outside your control, and also knowing that when the person's ready, they'll come, right? So we can't regulate someone that doesn't want to be regulated. Does that make sense? Anything else? That answer a question? Seems like okay.
Yes, thank you.
Yep. Okay. So, so if we're giving information or advice, right, like how to take medication or change a diaper or soothe an infant or latch your baby on properly, this is directive communication, right? But like I was saying, unless it's clear that's what someone wants, and I would really test this assumption by asking first, we want to communicate in a non-directive way. So if we're working with a client and they have concerns or strong feelings or a problem to solve or experiencing conflict, we want to start with non-directive communication. And again, you can always ask directly, do you want me to listen or to give advice? But here's what that looks like in actuality, right? I'll give you some examples. So active listening, it's like, I see, right? I'm nodding, I'm smiling, I'm maintaining eye contact, which is hard when I'm looking at a camera. I face the person, right? I'm not facing away. I may even like lean forward a little bit, kind of in an interested but relaxed way, as long as there's enough space for the person to feel comfortable. I stay focused, right? I'm not going to be looking at my watch or my notes, right? I'm not picking my nails, right? So really just like stop fidgeting, breathe, land, be present, right? This sort of shows that person that they're important to you versus the message they may have gotten for their whole lives, like that they don't matter, right? And they may even believe that themselves. So that's active listening. So what's called something called unconditional positive regard really is that shows that you're interested, accepts them, validates them. Like no matter what they do, you still regard them positively. For example, like you're going to look for strengths, right? Now, this is easier, honestly, when you consider that the behavior you're seeing is related to something that's happened to the client. So even just the question that was just asked, the avoidance, right? They're overwhelmed. The avoidance that, right? We see that for what it is. And then we can really just continue to regard that person in a positive light, even though they're really struggling. Reflect, right? What they're feeling. So you're worried about, or you're angry about, sounds like you're grieving, right? Question mark with curiosity. I'm approaching with curiosity. We may paraphrase. It's like, so you're saying, and then you state it in your own words. And honestly, paraphrasing really helps us highlight like assumptions that we're making that are incorrect. So it's paraphrase is a really helpful tool to use. We can clarify, which is very similar. So let me see if I get this right. For example, you're saying, and you're going to approach them with curiosity and open-mindedness. We're going to ask open-ended questions. How's it going? How have you been feeling? What would you like to talk about today? Versus very closed-ended questions, right? That'll give them space to sort of show up as they are in the moment. And this actually is really, really hard and requires a lot of practice, I think, is to give constructive feedback or handle conflict with I messages. For example, I feel scared when there's loud yelling. Now that is completely about me. So if somebody's yelling in the house, instead of somebody you're working with, you can say, I feel scared when there's loud yelling, right? It's about you. You could say something like, I feel worried, right? Because your feelings, you want to make it about you. Your feelings are your feelings. No one's making you feel anything. You're feeling something. So this is about taking ownership of your own feelings. Maybe you're triggered, right? We get triggered all the time. And we want to take a time out if we are triggered, right? This is like about the boundaries and what I own versus what someone else owns. They may be doing a behavior, but I own how I'm reacting to it. So like I said, a lot of these skills really need to be practiced. You're not going to just go out there and do it. It takes time and effort and practice, but it really does make a difference in how you communicate and helping people feel safe and connected to you. Traumatized people really need their caregivers to validate their experiences, understand their concerns, right? To feel heard, work with them to find the best way to cope, right? With situations, and then help them express their feelings. And if you don't have time, acknowledge the importance of what's being said, and then like schedule another time to talk through it with them, right? We can always say, you know what, I'm going to table this, or I always use like, can we pin that for a moment? And we'll talk about that later, and then follow up. Make sure you follow up, because that's that piece around trust. And just some last other things to think about. Mind-body disconnect. right? If someone says like, oh, don't worry, you can touch my leg, whatever you're doing with the client, I would really encourage you to keep on acting in a trauma-informed way. Their mind might be saying, oh, I'm embarrassed about that my body's pulling back from this person. Or they may not be connected to their body, right? And their body may disagree, like, no, I really don't want to be touched. But they're like, oh, no, you can, right? So we always want to keep sort of acting in a trauma-informed way. Take your time with people, pause, give them time to respond. If they're dysregulated, it's going to take them time to hear what you're saying, right? And come up with an answer. I used to use the example like with, when you're in labor too, right? You're in so much pain, or like right before you throw up, that feeling, and you're like, oh, I can't make a decision right now. I'm feeling so much, and I can't think. So it's very similar to when you're triggered, right? Even if you're hypo aroused or hyper aroused, I can't think about what you're saying. Recently, one of my clients went for a PET scan. She has a cancer diagnosis, and she really gave me some great feedback as talking about this presentation. And she was saying how her tech used a lot of trauma-informed care to help her, because she's usually in a freeze state and offline when she goes to get her PET scans. And these are some good examples she gave me. She said, repeat directions or write them down for people, right? Use your client's name repeatedly. It sort of grounds them in the here and now, like, hey, Sarah, blah, 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 or hey, Maggie, blah, blah, blah. Explain what you're about to do. Be descriptive and repeat yourself, right? She kept saying, like, keep repeating yourself. And this I never even thought of, but she was so right about it, is that she said, don't use time as a gauge, right? Because if someone's in these other parts of their brains, there's no time. And so she said, it's helpful to use events like, okay, I'm going to give you this injection after I come back out from that room over there, right? So it's like, use events instead. And I often think of kids like, we're going to have, we'll see Santa in 3 sleeps, right? They don't get time. And she said, it's that when we leave the room, it feels really not real when you're in that hypoaroused state. So having someone there does ground. So as like to talk about them, about sort of, I don't know, hold a rock while I go outside the room, or something that would ground someone. So really be curious and check your assumptions, which we talked about a little bit before, but it's really important so that people can really feel seen and heard, maybe for the first time, right? Understanding power differentials, especially if you're the one providing the service and holding the power, you're the expert, right? This can bring up a lot of things for people and their nervous systems, right? Primed about people in power. Like I had a client who didn't trust people in power because she didn't trust her parents. They weren't safe for her. So, and then always refer out, right? If it's out of your league, or you're struggling to help somebody, we have a list of resources at the Pentucket Mom Support website. And then Allison, can you put Pentucket Mom Support in the chat?
Sure can. You do have one question, Beth, in the chat.
Yeah.
And do you have any tips for looking for clues that it is okay to transition out of active listening to more of an active treatment, and or ask about what they'd like to accomplish for that day when your modality is not a talk-based therapy?
Right. That's a good question. Is that I think, you're walking into a situation, and the first thing you kind of need to do is sort of, once someone's regulated, right? So if they are looking at you in the eye, remember in the one slide I had like safety, and it was like, I'm looking you in the eye, I feel calm, I can hear you, right? There's affect on their face, like movement, they're responsive. So if somebody's like regulated and calm, you can even ask, you can say, so how are you feeling now? right? How would it feel? This is a great way to maybe phrase it, is how would it feel to move into some of the goal-based work we were going to talk about today? Some of the things that we wanted to get done today. How would that feel now? And sort of to see whether the person is ready. You can just ask them, how would it be if, right? Gives them some control, gauges, and honestly, if they're not, you're re-traumatizing somebody if you're trying to get something done and they're not regulated, right? They're not going to be there. They're not going to be on board with what's happening. So you can ask the question, and I would look for connection, right? Response, affect that's regulated, like a bunny. I'm just kind of cool and chill. Otherwise, use one of those techniques with someone to get them into that place and say, what would it be like if we did this exercise? And then we'll see how you're feeling. And then we can move into some of the work we had set up for today. How's that? Does that seem to answer the question? Yeah. All right. I'm just going to talk briefly. I know, we don't have a ton of time and I had a couple more things to talk through, but, if someone does disclose trauma to you, I wanted to give you just some helpful hints about what to say and what not to say. Okay. So I'm going to give you just some examples. So someone discloses a past trauma to you. Many of us might freeze in such a situation, right? Or we might feel like we want to flee or talk incessantly or overreact. But if we're calm, right, we want to acknowledge their feelings about like how it is to tell someone. So here's some things you might say. It might be helpful to say something like, I'm glad you told me. Sometimes abuse-related symptoms, come up in pregnancy and postpartum. How about we work together to keep that to a minimum? Or, I'm glad you shared your experiences with me. It's important because trauma really can continue to have an impact even in adulthood. Or, I imagine it's hard to tell me these things. It takes a lot of courage and I respect you for it. Or it can be helpful in our work together if you share your experiences since they may relate to your current concerns. But I don't need any more detail than you're comfortable disclosing. So sometimes when people talk about their abuse experiences, it brings up really strong feelings. How are you feeling right now? Right? Okay. So if there are no questions, I'm going to start talking about secondary trauma. We love this picture because I think this really reflects how we all feel after almost 3 years of a pandemic. We just, head down with our coffee in hand. So everyone relate to this picture, right? So what is burnout, right? There's a couple different names. Secondary trauma or trauma exposure response is sometimes the phrase that's used. What am I really talking about here? Here's some 16 warning signs, right? And I guarantee that a bunch of you are like, oh yeah, I have that, because I know I do, right? You feel irritable, exhausted. Maybe you have constant back pain or headaches or stomach aches, or how about reflux, right? Popping the Tums. We might feel cynical, like there's never an end to the work, right? We minimize, numb, we blame our clients. Our ability to like empathize or feel compassion is like kind of all but gone. We forget things, can't understand things easily, have a hard time holding space for others. We avoid people. Sounds like hypoarousal, doesn't it? We feel like a victim. We drink a glass every night to unwind, not a judgment, but we're numbing. We scroll our phone endlessly. We buy a bunch of stuff, right? We can't turn our brain off. We're constantly on the lookout for danger, hypervigilance. Sound familiar? Yeah. So what do we do about it? So I get it. There's a lot of work, not a lot of time for us to engage in these activities. but honestly, you're really not serving anyone, most of all yourself, unless you start to heal this burnout from all like it's been and we can get into burnout even without a pandemic, right? There's a lot of need out there, especially when we're providing, sort of help in the helping professions. It really requires like awareness, honestly, some space, presence, grounding, boundaries, gratitude. For me, it's enormous time in nature and play. How about playing? Someone said to me the other day, it's like, what's the difference, between playing is that if I'm throwing rocks and I'm skimming rocks, that's play. Playing Connect Four is, a little more like, right? We need a little bit of sort of that freedom. I mean, most days after work and even in between clients, if I really need it, I'll go outside and just try to breathe in the air, see what it smells like. Look at the sky, like, okay, the sky's still there. Get some perspective. Helps me realize, okay, even though there's horrible things happening or that, so-and-so won't call me back and she's super dysregulated and I can't help her, there's also beauty, right? And there's a bird flying around, there's birds tweeting, and the rhythm of the world goes on. It's so, so important for us to remember that. So many of these things can kind of be just about how you approach your life, right? So, and just kind of consistently practice that. So if you're driving to work, normally you drive as fast as possible. And well, maybe today you also look at the sky or take in the color of the clouds or the leaves, honestly. Maybe the people in the cars around you, right? Connecting to other people. So I wonder if you could just take a second right now and write down 3 things you can do today to lessen your burnout and remember the beauty of the world you live in. What can you do? Just simple, minute little things. What would they be? I'm definitely going outside because it's nice today, finally. Found a leaf last week. It was just like perfect red leaf. Left it on my counter for a while. Pet the dog. Animals really help ground us, by the way. All right. Okay, so I just want to here are some books and website resources. We already have Pentucket Moms in the chat. I'm gonna post some of these things. I'll post my bird video because I love my bird video. And then there's an emotional trauma first aid download that you can even Google that, it'll come up. And I'm going to post all those in the coalition's Facebook page, and then I'll ask Ashley, who does our Instagram page, to post some stuff there. And there's the EMDRIA website, which is if you're looking for EMDR therapy resources, which is a trauma therapy, there's a good spot to do that. There's a search engine in there. When Survivors Give Birth is like, Penny Simkin and Phyllis Klaus wrote that years ago about how to help women who've experienced trauma, sexual trauma in particular, during birth and postpartum. Those are all really helpful. Trauma stewardship is about secondary trauma, and that's sort of where I got a lot of those resources from. So, any questions? Any final questions?
No new questions in the chat, Beth.
All right. So I just want to thank everybody for coming and learning about trauma today. And for Allison, thank you for moderating the chat. So feel free to reach out to any of these resources for additional support. I'm going to post the link for this video on the Coalition's Facebook page also. And I will send it out via email to the Coalition. And if if you want to reach out to me, I'm happy to do that. It's beth@findyourstillwater.com. And I can give you some of the links if you're looking for them. So again, thanks so much for coming, and everyone have a great end of the week. Thanks.